Dr. Pillai, GP Lead, North Lincolnshire CCG. Today we're going to learn about some of the tools that we have within EMIS by Primary Care IT. The hot topic currently is with regards to the fact that we can't get routine bloods done courtesy of a shortage of reagents. And one of the things that I often ask myself is, are we actually getting the right bloods for our patients, or are we unnecessarily over-ordering blood tests for the sake of it being done, because it can quite easily be done? So coming back to some of the tool sets that we have, if you've got your patient on screen, double click on the alert bar. The first tip that I would say to you is bring the alert box all the way up to the top. Now you've got three different options over here: one results core, one results extended, and one monitoring. The one monitoring gives you a snapshot of the different QOF registers that this patient belongs to. So for example, CHD, depression, diabetes, and obesity. It's telling us when the last smoking status was done and what is actually due in this current QOF year, very quickly, just by hovering over one monitoring. Coming to the blood results, if you look at one results core, it will very quickly tell you when the last blood test was done for this patient. For example, I can now look to see that the FBC was done on the 24th of September. It tells me why it needs to be done on a yearly basis, because this patient's on antiplatelets and NSAIDs. Similarly with the EMIS, this needs doing every year because the patient is on the following medications: an ACE inhibitor, diabetes register, on metformin, and on NSAIDs as well. Now, how you use this tool is quite simply this. Just by hovering over the boxes, you can very quickly get a snapshot as to whether or not you really need to do that repeat UNE or LFT, rather than having to go into the investigations box or going into WebV, for example. So once again, just a useful tool. A few tips: open up the box, drag it all the way to the top of the screen, and then hover over your options.